Yes. First of all, if somebody was recovering from a stroke or a cardiovascular event, I would not do hyperventilation, which is involving 30 big breaths, because it causes vasoconstriction. Nor would I do breath holding, because it causes vasodilation. It's too much. I think it's okay for a normal individual, but for somebody that's recovering from cardiovascular, no, it would be too risky. Wim Hof, there is something in, of course, what he's doing. He's being able to achieve great things. But I'm interested about the science. I want to make a couple of points clear. When you take 30 big breaths in and out of your mouth during rest, big breaths, you cannot add any more oxygen to the blood.
This is the Recovery After Stroke podcast with Bill Gassiamis, helping you navigate recovery after stroke.
Bill from recoveryafterstroke.com. This is episode 19, and my guest today is Patrick McKeown. Patrick completed his training in the Buteyko breathing method at the Buteyko Clinic in Moscow, Russia. Having suffered from asthma, rhinitis, and sleep-disordered breathing for over 20 years, Patrick is able to offer both theoretical knowledge and his own experiences to help clients overcome similar challenges. Now, before we get started, if you have ever wondered what else I can do to help you with your stroke recovery, you should know that I have set up a few recovery after stroke support packages where stroke survivors can come into a community while trying to get better on their own and get help from people who are already further along in the recovery timeline. I too am a 3-time stroke survivor and a brain surgery survivor, and I have built for you what I was missing when I was sent home from hospital in the hopes that you don't have to do stroke recovery as tough as I did. Support packages give you access to a variety of tools 24 hours a day, 7 days a week, so that you can also work on other areas of stroke recovery that you don't get the chance to at physical therapy or rehabilitation. With tailored support available for less than $8.50 per week, all recovery after stroke support packages bring stroke recovery to you in the comfort of your own home. To try out recovery after stroke support and see if it is right for you, you will get the first 7 days free, as well as a 30-day money-back guarantee, no questions asked. As a bonus, you will also get 2 face-to-face Zoom support calls with myself to take your recovery to the next level. Go to recoveryafterstroke.com/support to sign up. It won't cost you anything for the first 7 days, and you will get a full refund if you are not happy after 30 days. You have nothing to lose and everything to gain. And now it's on with the show. Look, the reason why I contacted you, because I saw you being interviewed by another amazing person who's done amazing work in rheumatoid arthritis, Clint Patterson, who is somebody that I've interviewed for my podcast. And part of the message that I hope to get out about my podcast is that we have the ability to actually influence our health quite a lot by doing a whole bunch of different things. And rheumatoid arthritis and multiple sclerosis and all these ailments that we're supposed to never be able to cure, we're now finding that there's people all over the planet that have cured themselves and have used methods that have been put out there by people like Clint Patterson and other people who have stepped up to the plate and said, you know what, I'm going to find out how to resolve this medical challenge for myself. And I've become fascinated by that because part of my story is I've had 3 brain hemorrhages early in the piece. So back in 2012, when I first tried to find out how I'm going to get better from the impact of 3 brain hemorrhages and surgery, I came across an article and some work around the breath. And I couldn't believe that there was a possibility that I didn't know that I was breathing incorrectly. How common is it for people to be breathing incorrectly?
I think it's very common. Factors of modern life really play an influential role in breathing. And probably of all of the factors, stress is probably the biggest one. But also people's jobs. If one is talking all day, breathing volume changes, breathing increases. And it's ironic to say, but the issue is not that people are breathing less. The problem is that people are breathing, in most instances, too much. Because stress makes us breathe more. Excessive talking makes us breathe. Stuffy environments makes us breathe more. The belief that it's good to big breathe makes us breathe more. But the more air we breathe, the less oxygen that's delivered to the cells. And as human beings, we survive on food, water, and air. And just because food is good, it doesn't mean we should be eating 10 meals a day. Just because water is necessary and vital for sustaining human life, it doesn't mean we should be drinking so much water. And, you know, there's many research now coming out about the effects of overhydration, especially in sports. You know, athletes are often encouraged to make sure you're staying hydrated. But the problem is, where's the balance between being hydrated and being overhydrated? And if you drink too much water, it can be critical. So with air, how much air should we breathe? So we have all of these factors in modern life that's changing breathing and making us breathe more. So the part of the brain that regulates breathing becomes set, that we develop a habit of breathing too much. And then in simple ways, when we breathe too much, we breathe through the mouth, for example. We have excessive movement of the upper chest. We may sigh. We've heavy breathing during sleep, which is including snoring and obstructive sleep apnea. And we get breathless more easily with physical exercise. So we have to, you know, to consider that there is a cluster of cells in the brain that regulate our breathing volume. And if they are programmed to maintain a higher breathing volume, in essence, it disturbs blood gases and it results in less oxygen getting delivered to the cells. And I also have to say, you know, there's this belief that it's often espoused in Western yoga and in Pilates and in different modalities. And this is not to knock any of these modalities because they do wonderful work. But what's often told is, in the instruction of breathing, you often hear the students breathe in the class during rest. We should never hear somebody's breathing during rest. If you're doing very light exercise, your breathing should be so light, should be so effortless, should be so gentle. If, for example, I was to say to you to take 10 big breaths in and out of your mouth, your head will feel light. That's not a sign of over-oxygenation of the brain. That's the opposite effect that's happening there. The harder you breathe, the more you get rid of carbon dioxide from the lungs. This reduces carbon dioxide in the blood. And carbon dioxide is not just a waste gas. In order for oxygen to be released from the red blood cells, you need carbon dioxide. And if you breathe too much, the oxygen is not released so readily from the red blood cells to the cells. It's no point just having oxygen in the blood. We need to get the oxygen from the blood to the cells, to the tissues, to the organs, because that's where they're being used. And even in improving blood flow, people who are prone to anxiety, people who are prone to panic attack, we do gentle, soft breathing exercises to help activate the parasympathetic nervous system, which promotes homeostasis. And homeostasis is when, promoting homeostasis is when the body can help itself, that the body can recover quicker. But we don't do that through fast breathing, we do it through the opposite. And the other aspect about what we do is that we're opening up blood flow. So on one end, there's probably three things that are going on. One is, as you practice gentle breathing exercises, you have your attention from the mind onto the breath. So on a psychological level, there's structural changes that take place in the brain. So for example, the amygdala shrinks, so our ability to deal with stress improves. The second level is that when we're doing slow, gentle breathing, we're activating the parasympathetic nervous system. And the third level is when we're doing slow, gentle breathing, we're harnessing nasal nitric oxide, we're harnessing the benefits of carbon dioxide, we get improved blood flow and improved oxygen delivery. So in a nutshell, there's a way to breathe, a way not to breathe. Yeah. And what I want to impart is how to breathe to improve oxygen delivery, as opposed to what's commonly being taught. Because what's commonly, you hear it on radio, TV, the instruction, take that deep breath. And what I often see then is I see a big breath. I don't see a deep breath. A deep breath is diaphragmatic, but a deep breath is light. A baby deep breathes. So good breathing is through the nose, is driven by the diaphragm, which is deep. It's effortless, it's silent, it's gentle, and it's paused on the exhale. It's light. That's what good breathing is. And anything outside of good breathing, we would consider it abnormal breathing.
Yeah, wow, that's amazing. I want to talk about, you mentioned activating the parasympathetic nervous system.
Yes.
Is that because people who are incorrectly breathing are often activating the sympathetic nervous system?
Yes. If you breathe through your mouth, yeah.
And that's more likely to cause anxiety, increased cortisol levels, increase all of the stress hormone, increase the heart rate, the blood pressure. That keeps people sort of in this heightened state of, stress.
Right. And it also affects our sleep. One simple adaptation which changed my life was to switch from mouth to nose breathing. And I know that might sound so simple to a lot of your listeners, but we have to bear in mind that studies show up to 50% of children habitually breathe through an open mouth. We don't have studies for adults. It doesn't get studied. But I would suspect that it's reasonably high. How many adults sleep with their mouth open and wake up with a dry mouth in the morning? How many adults, when you meet them on the street, they're doing gentle walking, but they're mouth breathing? So let's just look at the mouth. So look down at your chest and tummy and take a breath in through your mouth. Now, so when you mouth breathe, what part of your body moves?
My chest.
Okay, so let's look at the lungs. The lungs are triangular. And the bottom of the lungs, the bottom part of the lungs, is where the greatest concentration of blood flow is because of gravity, because we are upright. So gravity determines that the greatest concentration of blood is in the lower parts of the lungs. When we breathe through an open mouth, we breathe into the upper part. So we're taking air into the upper part, but the greatest concentration of blood is in the lower part. Now, when you breathe through your nose, you start taking the air from the upper part of the lungs down into the lower part. But also, when you breathe through your nose, you carry this gas called nitric oxide. And nitric oxide comes from the sinuses, is released into the nasal cavity. So when you breathe through the nose, you carry nitric oxide in the lungs. And nitric oxide brings the blood from the lower parts to the upper parts. So it's called ventilation perfusion. And that improves by breathing through the nose and breathing softly through the nose. Another thing about nitric oxide, it improves arterial oxygen uptake. Nose breathers are better oxygenated than mouth breathers, and it's estimated to be between 10 and 20%. Nitric oxide coming from the nose sterilizes the incoming air. It's a pulmonary vasodilator. It helps open up the blood vessels, and it's also a bronchodilator. It helps open up the airways. So human being is the only species in the planet that spend most of their time that habitually mouth breathe. If we were to look at the animal world, with the exception of a dog, every animal breathes pretty much through their nose, except in situations if they're sick. So mouth breathing is synonymous with a stress or a fight or flight response. Our ancestors would have mouth breathed only in times of stress. Nasal breathing was enshrined. How do we know? We know by the shape of the skull. Anthropologists know that if an individual has been mouth breathing, the tongue has been resting in the roof of the mouth, and the tongue is U-shaped, and as the child is growing up, it forms a wide palate. So they know all they have to do is look up into the roof of the mouth and look at the maxilla. If the maxilla is nice and wide and U-shaped, that individual grew up as a nose breather. But if the individual has got a high upper palate and a narrow maxilla, and sometimes of course it's going to be overcrowding of teeth, that individual was a mouth breather. So we know that the first documented cases of mouth breathing only happened about 300-400 years ago. Not that long ago, in the scheme that we've been here for 200,000 years. Go to a history museum. Look at those beautiful formed faces. And what we also need to look at is, because you're looking at cardiovascular health, if our face develop the way they should do, we should have forward growth of the jaws. And if you have forward growth of the jaws, you've got good airway. Airway is king. If you've got good airway, you have a significantly reduced risk for obstructive sleep apnea. Now, our kids are going around with their mouths open. The vast majority, or not vast majority, but I'm saying a certain population of the adult population is mouth breathing. That in turn then is reducing airway size. Then when they go to sleep, they're more likely to have snoring and obstructive sleep apnea. And obstructive sleep apnea is when the individual is snoring, but then they stop breathing. And as they stop breathing, their blood oxygen saturation lowers enough to partially awaken the brain to get them out of the deep sleep. So they don't have a deep sleep, but they also have a stress to the heart. So if you're stopping breathing so many times an hour, every night, every week, for months, for years, over time, that heart, that's what we need to look at. And the heart is a muscle. It needs its own blood flow and oxygen. And if we're not sending sufficient, hyperventilation, overbreathing, and breathing too much, it causes our blood vessels to constrict. And it's been shown that coronary blood flow, the amount of blood flow reaching the heart to feed the heart with oxygen, that reduces. So we have to bear in mind for cardiovascular health that our breathing is not just this involuntary activity. Through our breath, we can influence vital functions. And through our breath, we can improve our health. And it's not by taking the deep and the big breaths that's being taught. And sometimes people say to me, they couldn't have all got it wrong. And I say, listen, in order to teach breathing, one should have a basic knowledge of the physiology behind breathing. One should be aware of what's called the oxygen dissociation curve. A very simple curve. It's an S-shaped curve. And what it states is that the release of oxygen from the red blood cells takes place in the presence of increased body temperature, phosphoglycerate, or carbon dioxide. And carbon dioxide is what I'm looking at. Don't breathe too much. You get rid of your CO2 and the bond between oxygen and hemoglobin strengthens. So, it's a fascinating area that this idea has become widespread. It's like telling individuals food is good, eat more. Air is good, breathe more, without realizing that the more air you breathe, the less oxygen that's delivered. And even the brain. There's a brilliant book called Behavioral and Psychological Approaches to Breathing. It was written, 1994 it was written. The information is still valid today. Two medical doctors, they showed that the carotid arteries that supply blood flow to the brain can constrict by up to 50% from overbreathing. 50%. How many of your listeners will wake up tired after 8 hours of sleep through an open mouth?
Many.
They've had loads of oxygen coming in because they've been breathing heavy all night long. But that's the problem. The heavy breathing, less deep sleep, less oxygen getting to the brain, and less rested sleep. And sleep is vitally important. Wow. If sleep is right, the body can help itself during the day. So we need to look at kind of the entirety. And, what I say to people is, try this for a couple of weeks. That's all. Start breathing through your nose. And I'll go through an exercise, so I'll give you an exercise people can start practicing. And what we can do is we'll check, can you activate the body? Can you change the body's temperature by changing your breathing? So we'll do that together as an experiment today.
All right, we'll do it in a little while. I want to go back because you said something really astonishing to me. You said that this change in our breathing has only happened in the last 300 to 400 years.
Mouth breathing during rest.
Yes. What happened that caused that change to occur? What is it that made us change our breathing?
So the question is, how did people...
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
People switch from predominantly nose breathing to mouth breathing. We believe it's due to processed foods. Processed foods and sugar have been around for a long time. Sugar has been around in the UK. It was when they unearthed skulls from upper middle class people in the 17th century. And that's when they had the first documented cases of malocclusions, which is overcrowding of teeth. Overcrowding of teeth now has become endemic. Why is it just the human population that is overcrowding? Okay, you will have a small percentage of animals, especially dogs, which we have kind of crossbred as well. But say in wild animals, it's not very common to have overcrowding of teeth in the wild animal population. It's more so because we've kind of interfered with the dogs' diets and everything else. It's thought to be linked to sugar. What's the relationship between sugar and causing a change to the immune system? Well, the biggest prevalence of mouth breathing is by nasal obstruction. The nose gets blocked. Now, we know that the nose gets blocked due to overbreathing. How do we know that? Because we show individuals how to unblock the nose by softening their breath. If you start reducing your breathing, carbon dioxide builds up in your blood and your nose opens. That's just a normal physiological thing. As you reduce your breathing, carbon dioxide builds up in your blood and your airways, lower airways, they start to open. And also there's less cooling and drying out of the lower airways. So there was a very good book written back in the 1930s. Now, people might criticize a little bit because of the scientific protocol, but back in the 1930s, there wasn't as rigorous a scientific approach as there would be today. But the book is really an observation. It was written by a Dr. Weston Price. He was a dentist, and he was fascinated with jaw sizes, shape, faces, the shape of faces, the shape of jaws, malocclusions, etc. He went to various indigenous populations, Maoris, Eskimos, Aboriginal, the Gaelic people off the Hebrides Islands. And he noticed that all it took was one generation of a switch from a traditional diet to a processed diet. Within one generation, structural changes happen to the face. And I believe that these structural changes are getting worse and worse and worse. My mother and father had facial structures. They had no malocclusions, they had good straight teeth. All of us were mouth breathers, 6 of us, all mouth breathers. I was born in 1973. I was a mouth breather, my nose was constantly stuffed, my nose is bent, my upper jaw is set back, my lower jaw is set back, so I would be an ideal candidate for obstructive sleep apnea, which I experienced during my teenage years, but it was undiagnosed. I was exhausted, nobody put the connection together. Now my daughter is missing 2 teeth. So my mother's face and father's face were wide. Our faces were narrower, and my daughter's face was the jaws are even narrower, because congenitally she's missing 2 teeth. She's got pseudogenesis. She's 7 years of age. I had a scan done because the adult teeth are always sitting just above the baby teeth. So a scan will reveal, and there's 2 incisors missing. If there's missing teeth, there's a high risk of obstructive sleep apnea. It's so important for normal development of the jaws and face because airway trumps everything.
Wow.
If the airway is not doing what it's doing, there's going to be sacrifices made in the body and sleep is affected. And again, the problem with sleep is the link, and there is a link now because I'm currently rewriting a new book on sleep, rewriting my original book on sleep, and there is a link now with cancer, and there's a link, of course, with cardiovascular ill health. So there is a link with sleep apnea, sleep disorder, breathing, but it stems back to the development of the jaws and the face, and it's back to breathing.
I know with the sleep apnea being an issue with people causing stroke because they don't get enough oxygen to the brain during sleeping
Yes.
moments when they stop breathing. And I've met a few people that have experienced stroke because of that. And
Yes.
for whatever reason, it wasn't worked out early enough that they were in such a serious state, but it was normal for them. That's the thing that I'm trying to the point that I'm trying to get to is that it was a normal breathing pattern. They didn't know any different. They didn't know that they weren't breathing properly, and they just put up with it. And they didn't know why they
Yes.
were always exhausted, and they didn't know why they had all these challenges.
Yes.
And the last thing they ever expected was a stroke. But the stroke was
Yes.
what allowed doctors to work back and diagnose the sleep apnea and the
Yes.
problem with the breathing.
Yes. Cardiovascular complaints, always look at sleep.
Yeah.
In the 1970s, Dr. Christian Guilleminault, he's a French doctor who's in Stanford. He suspected that people with high blood pressure, something was going on in their sleep. This is just people with high blood pressure. He teamed up with a cardiologist. They monitored the blood pressure of individuals during their sleep, and they found that when the individuals were holding their breath, that their blood pressure rose dramatically. Holding of the breath during sleep. I do breath holding for sport, working with athletes. We do simulation of high altitude. We hold the breath to lower the blood oxygen saturation down to about 85, maybe 80% at the lowest. It's tough going. It's tough. Even for an athlete, it's tough. Individuals in their sleep are involuntarily holding their breath to lower their oxygen saturation to as low as 50%. Now that's equivalent to climbing Mount Everest without oxygen.
Wow.
So you can imagine the stress that that's having on the individual.
Yeah.
And yes, I as a teenager was exhausted in school, and you learn to live with it. And it's not, you still know something is not quite right. Most people with obstructive sleep apnea, I believe that they've came across it because their partners had heard them sleep. And their partner is there lying awake, and the sleeper is there, they're heavy breathing, and then they're stopping breathing. And that's when they start investigating it. Now, Dr. Christian Guilleminault also developed the apnea-hypopnea index. And that's a measurement that's still used today. Now, most recently, and he's a man now, I'm not sure of his age, but I'd say he's in his mid-70s. He's writing papers. He's still working, actively working. He's writing papers. We must teach our children to breathe through the noses. I've attended a number of conferences where he spoke, and I was lucky enough to speak at the same conferences. I have heard him say, we need doctors, we need engineers, we need highly qualified people, but as long as children are having sleep disorder breathing, which is influenced by whether they're breathing through their nose or their mouth at night, he said, if they're having sleep disorder breathing, their brains are getting fried. And that's, I quote him. So that's happening a young child, and that then can set up behavioral issues, of course, because the child is frustrated and they're wound up. And the same as with an adult. You know, here is back to, so here is the top sleep doctor in the world in 2014 talking about the importance of nose breathing during sleep. It has been tested. We use a paper tape across the lips at night. I sleep with a piece of paper tape across my lips every night. That sounds bizarre. I've done it for 20 years. The reason I do it is it makes a massive difference to my night's sleep. You cannot have a good night's sleep if you're going around with your mouth open. And if you're mouth breathing during the day, it's going to set you up for disordered breathing during your sleep. So we need to look at breathing.
Sorry to be a bit cheeky, but that wouldn't be any good when you go across to give your wife a kiss on the cheek.
Well, it's either that or snoring or obstructive sleep apnea, so she can make the choice in that one.
Well, I say that to lighten up the situation a little bit, but I realize it's actually quite dramatic, this situation, because I'm somebody who, up until I saw your previous interview for a couple of weeks ago, and before I bought the book, I was a mouth breather, and I still am, but now I'm noticing my mouth opening, and I'm noticing the change. So I'm going back to closing my mouth and breathing through my nose. And I'm
Yes.
noticing that it's becoming easier for me to do that and to change that habit. It's interesting that you say that food, processed food, including sugar, well, there's another reason we should quit sugar. I know why I've quit it was for many other reasons, but there's another one. But what's interesting is that I constantly have this feeling behind my, at the top of my mouth that it's inflamed and it's always sort of full of, what's the word, mucus or some kind of, there's a lining of something there. And that is what triggers my mouth opening. And even though my mouth is open, that doesn't go away. I wake up with a dry mouth. But when I do close my mouth and focus, even though that's still there, I still can breathe through my nose. Yes.
Now, with your population of listeners, there would be certain exercises that I would not teach. A general exercise that we would do for a normal population that wouldn't have any risk of any cardiovascular issues. We do breath holding to open up the nose. But the risk of doing breath holding is that carbon dioxide will increase too quickly, blood vessels will dilate very quickly. And if there was a blood clot or anything like that, it could release and it could cause a problem.
Right, wow.
So instead we do, to unblock the nose, go out for a walk with your mouth closed. If you do physical exercise with your mouth closed, your nose will start running, but bring a hanky with you, but you'll start opening it up. So gentle physical exercise, exactly what the individual is doing. A person who is from a cardiovascular event after 3 months or so to get into moderately paced walking could be very good. It stimulates blood flow. It stimulates the production of nitric oxide inside in the blood vessels. And nitric oxide is a molecule that's specifically one of the functions is for lowering high blood pressure. Nitric oxide is one of the most important molecules in the human body. It emanates from the paranasal sinuses to work in the lungs, but it's also produced by the blood vessels to help relax and open the blood vessels. So physical exercise is very good to help open up the nose, but the more you breathe through your nose, the more your nose starts to open. Now, what I'd like to do is go through a simple exercise. So, by the way, you can't do it incorrectly, really. So just give it a shot and see how you go with it, yeah? It's not a test or anything like that. So if you put one hand on your chest, Bill, one hand just above your navel. So one hand on your sternum, one hand just above your navel. So even to bring your top hand just up a little bit to get it onto the sternum. That's it. And just feel your breathing. Allow your shoulders to relax. And just kind of tune into your breathing pattern. Now don't worry how you breathe, just breathe as you're normally breathing. So just tune into your breathing pattern. So you feel that breath in, you feel the breath out. You feel the breath in, you feel the breath out. You feel the breath in, you feel the breath out. Start feeling the airflow as it comes in and out of your nose. You feel your breathing in and you're feeling breathing out. And feel the slightly colder air as it comes into your nose and feel the slightly warmer air as it leaves your nose. So you're feeling the slightly colder air coming in and you're feeling the slightly warmer air leaving. Gently start to slow down the speed of the air entering and leaving your nostrils. That's all. Only concentrate on the air. It's a very simple exercise. Gently slow down the speed of air as it enters and leaves your nostrils. And slow it down sufficiently to the point that you feel like as if you're going for a mild walk. So gently slow down your breathing to the point that you feel slightly breathless. So you're slowing down the speed of air as it comes into the nose, and you're slowing down the speed of air as it leaves your nose. So you're taking a slow, gentle breath in, and you're having a relaxed, gentle breath out. And gently soften the breath. Gently quieten the breath. Don't hold the tummy or restrict your breathing. Don't hold your breath. Just gently soften your breath. And do this for about 3 minutes. I need you to feel that slight air hunger. You're doing it correctly when you feel that you're not getting enough air. So your whole objective is to just gently soften your breathing. So you'd like to breathe a little bit more. Now, if it got a bit stressful for you, make your breathing a little bit bigger. So it shouldn't be stressful. And at the same time, you should feel a slight air shortage, a tolerable air shortage. So all you're doing is just gently slowing down the speed of your breathing to soften your breath. Now, as you soften your breath, you take in a higher concentration of nitric oxide from the nose into the lungs, where it assists in arterial oxygen uptake. At the same time as you soften your breath, carbon dioxide accumulates in the blood. And it's carbon dioxide that sends the signal that you need air. So the fact that you need air is telling you that there's a slight increase of CO2 in the blood. The increase to CO2 in the blood will open up the blood vessels. 100,000 miles of blood vessels throughout the body. As you slow down your breathing, you can open up your blood vessels. As you slow down your breathing, you can open up your airways. And as you slow down your breathing, you allow more oxygen to be released from the blood to the cells. But the key is the air shortage. People meditate because it has wonderful effects. The purpose of meditation is to allow your breathing to go slow and soft. We want the breathing to go slow and soft, but we take it one step further. We want that slight air shortage. The slight air shortage is the key to opening up the blood vessels and activating the parasympathetic nervous system. Do you have air shortage there, Bill? So now just take a rest for a little bit. Take a rest. So just as a matter of interest, now you mightn't have, try and breathe through your nose now, by the way. The air shortage shouldn't be too intense either. It takes a bit of practice. Like it's only kind of an introduction, because all I want to do is, I want people to try it. I want people to leave with this. How you breathe influences 100,000 miles of blood vessels. Is there any change in body temperature there, by the way? There may or may not be. Just is there a change there? Are you cold or warm or the same? Do you notice anything?
I think I'm a fraction warmer.
Okay. Is there any change in the saliva in the mouth? Is your mouth drier, more moist, or the same?
There's less saliva, but it doesn't feel dry.
Okay. Now, when you do it, I wouldn't worry about the first time because we don't always get it. But when you do it with a little bit of practice, that's all it will take. So what I would say to your listeners is, practice this 3 minutes by 5 times a day. It's only 15 minutes. 3 minutes here, 3 minutes there. You'll start to feel warmer because you get vasodilation. And you'll start to feel increased water saliva in the mouth. And also the nose will open up. We have to think about, how do we breathe when we get stressed? Our breathing gets faster. We breathe more through the mouth. We sigh more when we're stressed. We start taking more air into the body when we're stressed. We breathe more. Our breathing becomes more noticeable when we're stressed. So how do you counteract stress? Don't take the big breaths, because that's only exaggerating the stressed breathing. To counteract stress, we need to do the opposite to how our breathing changes during stress. Instead of breathing faster, we breathe slowly. Instead of breathing through the mouth, we breathe through the nose. Instead of breathing using the upper chest, we breathe using the diaphragm. Nose breathing will start activating the diaphragm. Instead of having noticeable breathing, we have invisible breathing. And instead of breathing more, we slightly breathe less. And that's the key, you know?
It's very interesting. I've noticed definitely that I can do it better than I was able to do it even 3 weeks ago before I knew about your work. Even though I had done a lot of breathing exercises and I've been to yoga and I've done all those things, it is enjoyable and I did get a lot out of it. But I've never really had a definitive understanding as to what I was doing when I was changing my breathing. I knew I was influencing the sympathetic and the parasympathetic nervous systems. I knew I was doing that. But I didn't really understand, the next sort of level, how I was changing the chemical composition of my blood with
Sure.
Carbon dioxide and oxygen. Now, I'm curious about the alternating breathing pattern that people use sometimes in yoga we get taught to use
Yes.
alternate nasal passages for the
Yes.
breathing. Tell me about that. Is that something that you think is beneficial?
I do, provided that it's done lightly. I think one of the reasons that that is being done, or at least I know one of the benefits from it is that if you're right-handed, whatever nostril you breathe through, you activate the opposite hemisphere of the brain. So, for example, if you're predominantly breathing through your right nostril, you're activating the left hemisphere of the brain. And the left hemisphere of the brain is a little bit more excitatory. So if you block your right nostril and you breathe through your left, you activate the right hemisphere. And the right hemisphere is that calming effect. So the alternate nasal breathing is to activate different regions of the brain. Now, generally, with a normal individual, you will have one nostril that's slightly more blocked or congested than the other. And they should switch every 3 hours, every 90 minutes to every 3 hours. But with chronic rhinitis, people who have nasal obstruction, it may not switch so readily. So there's where alternate nasal breathing. Now what we do is we simply just have people block one nostril. So block one nostril. So now you feel a higher concentration of airflow coming in through the other nostril and slow down your breathing. Because alternate nasal breathing is brilliant, but do it with light breathing. If you look at, the ancient scriptures of yoga, and next week I go to a yoga school. Robin Rothenberg, I go to the United States on Friday. And I work with, we have with 20 yoga teachers. We will be exploring the whole aspect of breathing with 20 yoga teachers there. And I know Robin has spent some time going back to the ancient scriptures of yoga. And she said, Patrick says, the one word that's coming out there is the word subtle. That when breathing was described, it was also always subtly. Now, subtle breathing is light breathing. And yogi masters had this ability to change their metabolism to almost to the point that they were clinically dead. They would do that through the breath, but they didn't do it by taking big breaths. They do it by soft breathing. Chris Pei, he's in Qigong, a master of Qigong. He said there's 3 levels to breathing. The first level of breathing is that the person next to you cannot hear you. The second level of breathing is that you cannot hear your breathing. And the third level of breathing is that you cannot feel your breathing. Now compare that to the student in yoga you can hear their breathing. You can hear their breathing, they can hear their breathing, and they can feel their breathing. And that's not, the message has got lost in the translation as it was passed down. And over the next coming years, hopefully I will have the time, and with associates such as Robin, etc., to put a book together to explain what is the missing piece in yoga. Let's go back to the basics here, because the message got lost in translation. And until then, I would say to people, practice. You've been practicing your yoga breathing for 10 years maybe. Practice breathing lightly. 3 to 5 minutes a day, 5 times a day. So it's only about 15 to 25 minutes throughout the day.
Yeah.
Softening the breath, quietening the breath. Whenever you've got a little free time, slow down your breathing. Look at getting the mouth closed at night. I did a full sleep presentation to the American Academy of Craniofacial Pain in Vancouver in November. It's 1 hour of a presentation. I've put the entire presentation up on YouTube. Anybody who is looking for information, if they want to find out more between the connection between breathing and sleep apnea, I put a lot of research. It's all up there.
Yeah, we'll put
the presentation. The presentation was made to medical doctors, dentists, orthodontists, and people in sleep medicine. So it's looking at it from a medical point of view, looking at it with the science. So I think you can really start helping yourself by doing 2 things. As I learned 20 years ago, I learned 2 things. I learned breathe through your nose and breathe less. And that changed my life.
Wow, it's so simple, and yet people are going to find it difficult because changing patterns and behaviors are not easy sometimes, but that's okay. I mean, it's just about persevering and getting help. If somebody needs to get some help, they can get help from somebody to guide them through that process, whoever that might be. So let's just assume that it is easy to change, it is easy to do, and let's work towards that. While I've got you, I also want to address the question that always comes up. I know that it does because I've listened and seen a lot of your interviews. Is the Wim Hof method comes up a lot with you in discussion. So I know there is, for the people listening and watching, there's a link that we're going to put at the end of the episode that's going to send people there to give them the understanding of the difference between your method and the Wim Hof method so that people understand and we don't have to address it here.
Yes. First of all, if somebody was recovering from a stroke or a cardiovascular event, I would not do hyperventilation, which is involving 30 big breaths, because it causes vasoconstriction. Nor would I do breath holding, because it causes vasodilation. It's too much. I think it's okay for a normal individual, but for somebody that's recovering from cardiovascular, no, it would be too risky. Wim Hof, there is something in, of course, what he's doing. He's being able to achieve great things. But I'm interested about the science. I want to make a couple of points clear. When you take 30 big breaths in and out of your mouth during rest, big breaths, you cannot add any more oxygen to the blood. Your blood, Bill, as you're sitting there, breathing quietly, is almost fully saturated with oxygen. Your blood is almost fully saturated. If you start breathing more, you're not going to add any more in. So you cannot bring in more oxygen by breathing more. What happens when you take big breaths is you get rid of the gas carbon dioxide. You get rid of it from the lungs, and by getting rid of it from the lungs, you get rid of it from the blood. Carbon dioxide is the alarm to breathe. Your body breathes to breathe out excess CO2. If you breathe heavy and you get rid of a lot of CO2, well, then the alarm to breathe has been depleted. So if you do 30 big breaths and then you hold your breath, you'll naturally hold your breath for a lot longer because you've got rid of CO2, because the alarm to breathe has been depleted. Breath holding, we would see breath holding is very helpful for normal individuals and children. It's a little bit stress exercise. It's a little bit stressful on the body. Generally it's fine. Just with the cardiovascular, I would steer away from it. But we would see an improvement to immunity. We would see less colds, less chest infections. We would see people with chronic fatigue. Once we get them to a certain level, that we just gently step them up. And then when they've reached a certain level, then we introduce breath holding. Because what we're doing is we're just gently pushing the body out of its boundaries. We're purposely lowering oxygen saturation, and we wear a pulse oximeter when we do it. We do lower blood oxygen saturation during the breath holding, and we do increase CO2. The difference between our method and Wim Hof is Wim Hof has 30 big breaths and then holds. We hold. That's it. Now, our method would be looking at it more than from a health point of view, addressing dysfunctional breathing patterns. How should you breathe 24/7? What's good breathing? So the breath hold exercise that we would do is only one part of what we do. The key is what we did together. That's actually the key. Get your breathing right during rest. Get your breathing right during sleep. Have light breathing during sleep through the nose. You wake up more alert, and also, of course, you're getting the benefits of helping the body to help itself. So Wim Hof's, his stuff is brilliant, but we have to ask what's going on with the science, because it could put the message out there that it's good to take big breaths. And I want to say, categorically, please do not take big breaths. The only purpose it serves during rest is to deprive the body of oxygen.
Yeah, I hear you loud and clear. I'm coming from an angle of healing the brain. As I mentioned, I've had 3 brain hemorrhages and surgery and all that type of thing. I have left side deficits, so my left side is numb and it's colder, and the motor neurons are a little bit sleepy, and it takes a little bit of time to get them going, and the sensory neurons are overexcited, and when somebody touches my hand, even the wind blowing across my arm, you know, the hair hurts. It hurts. It sends a message. So my approach is coming from how do I benefit my brain in the healing process? How do I support it? And I do lots of things. When I sit in front of a computer, I wear, you know, glasses that have an orange tinge to cut out blue light, because blue light tires the brain and stimulates and decreases the amount of melatonin in the body, and tells me that at night I am actually, you know, going through an awake cycle more than a sleep cycle, to put it simply. So how would you describe it in the next, we've got 10 minutes to go, so how would you describe the benefit to the brain? I know that you mentioned oxygen and all that type of thing, but what does it do to the brain when we change our breathing pattern and our method of breathing, and we close our mouth at night instead of keep our mouth open?
Okay, well, most certainly when you breathe through your nose, you get a deeper sleep. You fall into, they've done a study. Again, I think I have it referenced in the video up on YouTube. They got 8 subjects. They had them breathe through their mouth on one night and breathe through their nose on the second night. When they had them breathe through their mouth, the quality of their sleep reduced dramatically. And one individual developed obstructive sleep apnea just by switching from nose to mouth breathing. When they slept with their mouths closed, their quality of sleep was deeper, was better, they were more rested. And that's huge, because there's 8 hours there. Like sleep, everybody talks about quantity in sleep. And I'm actually glad that you brought up about blue light. We shouldn't be on a laptop probably 2 to 3 hours before sleep, because it does. A laptop, mobile phone technology, it sends a blue light. As you said, the brain stops producing melatonin, which is the a relaxant, and as a result then we are awake, we're more readily, we don't have a deeper sleep. The other aspect about slowing and softening your breathing is that you do get more oxygen getting to the brain. It seems to have an effect on brain cell excitability. People are calmer. So Robert Fried, he wrote that one of the first stages of depression is hypoxia. So he's saying that, you know, conditions such as, for instance, depression, we certainly know that panic attack is influenced by your breathing, because you remember the old kind of remedy for a panic attack was breathe in and out of a brown paper bag. The purpose of the brown paper bag was to rebreathe CO2 back into the body, so to bring in CO2 to allow blood vessels to open to get more oxygen to the brain. So if you watch somebody in a panic attack, they're in a state of extreme stress. It's dreadfully looking at it. Their breathing is heaving, their blood oxygen saturation is lowered, but that's influenced by their breathing. So when I work with somebody with panic attack, I ask the question, how are these people breathing during the day? How is their everyday breathing? They're mouth breathing, they're sighing, they're upper chest breathing, and they've got dysfunctional breathing patterns. And then they get into a crowded environment, or they're driving their car, and a little bit of stress from that pushes them over. But the problem isn't the car. The problem isn't the crowded environment. The problem is their everyday breathing. We, as human beings, are very resilient. And when everything is working, we've got a good cushion to be able to cope with these stresses in life. But when the cushion is reduced, it doesn't take much to throw us over the edge. And chronic hyperventilation is one of those things where you have a group of individuals and are teetering on the brink of symptoms. There's, you know, papers written on this, like hyperventilation, a diagnosis begging for recognition. Hyperventilation, the tip of the iceberg. Jenny King wrote a paper on the effects of hyperventilation back in 1988. I can't remember the title, and she explored, you know, these people, all it takes is just that one event just to push them over. Well, let's change their everyday breathing so they have the resilience to cope with whatever life has thrown up.
I just want to share that little message that you said about anxiety and depression. It's interesting that if you notice somebody who's depressed, they're hunched over, their shoulders are forward, and it's stopping their lungs from being able to expand.
Yes.
With regards to anxiety, I was never somebody who suffered from claustrophobia, and I was going to an appointment to have a MRI some years ago, and it was before I had the brain hemorrhage. And on the way there, unfortunately, I came across a scene in a car accident where somebody was deceased on the side of the road. And I associated that to then going into this situation where I had to lie still in an MRI machine. Yes. And I became anxious and claustrophobic, and I couldn't deal with it. And then a few months later, I had a brain hemorrhage. And of course, when you have a brain hemorrhage, you have an MRI every three days, for them to work out what's going on. And I had to get myself sedated. I had to be sedated because I couldn't be in the machine. And after about 4 years of dealing with the side effects of the sedation and not being able to go home on my own and needing somebody to pick me up, I said, I had enough. I'm not going through that again. I'm not going to take sedation again. I'm going to get into the MRI machine, and I'm going to manage the condition of the anxiousness on my own. And I employed a breathing pattern that I learned from a gentleman, from two guys who wrote a book called M-Braining, which was a 6-second in-breath and a 6-second out-breath. And what that I understood it does is it balances the sympathetic nervous system and the parasympathetic nervous system, and it brings you into homeostasis. And we did a 6-second in-breath, 6-second out-breath, and that was able to get me through 35 minutes of MRI. So this is powerful. It does work, and it meant that I didn't have to put another sedative in my body, which over the 4 years that I've been doing MRIs, I was just getting bogged down with all these things that I had to detox. So I truly believe in your method and in your approach, and that's exactly why I contacted you. So for the people listening, this is powerful. I have definitely gained a lot from changing my breathing patterns, and this is going to help me take it to the next level. You suffered from asthma, and because I know that it's a real serious thing and people die from it, I want to touch on that just before we end up finishing. Yes. How does this help people with asthma? What does it do to make it better?
Very simple. People with asthma breathe too much. And you could say that, what's the chicken and the egg here? If you breathe excessively, you cause the airways to cool and dry out, and you lose CO2, etc. But your airways constrict in response to excessive breathing. Right. But as your airways constrict, you feel you're not getting enough air. And when you feel you're not getting enough air, you want to breathe more to compensate. But that feeds back into the condition. So Dr. Buteyko said that the noisy and deep breathing of an asthmatic had always been considered an outcome of the disease, an outcome. But nobody could suspect that the big breathing of the asthmatic was feeding back into the disease. Right. So for 20 years, mouth open, I was sighing, I was heavy breathing, I was constantly plugged up, I was snoring at night, and I had obstructive sleep apnea undiagnosed. I was a heavy breather. I started learning how to unblock my nose by holding my breath. I started slowing down my breathing. I reset my breathing center by practice. The more you practice softening the breath, you retrain the brain. That regulates your volume. In 1 week, my asthma improved more than 20 years. Wow. So it totally, now at the time there was one clinical trial, that was back in 1994. It was conducted at the Mater Hospital in Brisbane. They compared the Buteyko method with a control group which was taught the in-house hospital program at the Mater Hospital. The people doing the Buteyko method, they had 70% less symptoms in 12 weeks, 70%. They had 50% less need for inhaled corticosteroid, and they had 90% less need for bronchodilator medication. Wow. The control group, which was taught the breathing exercises at the Mater Hospital, have changed. Now, I'm not here to knock the control group. I'm here to point out the Buteyko group were taught how to reduce their breathing. The control group was just taught diaphragmatic breathing. We have to reduce breathing volume. There is now 14 clinical trials on this. I've been involved in different ways with 5 of them. We used one for the nose. We reduced rhinitis symptoms by 70%. One of the more recent trials used my book, Close Your Mouth. They didn't have a practitioner. They just read the book, took the instruction from the book, and used that in the Buteyko. They said, we don't know exactly what's going on here, but in quotes, if this was a drug, it would be widely available. There is an issue that we as breathing people don't have the marketing budgets to get the reach to help put it out there. We do our best through YouTube, podcasts, books, because a book is accessible. You know, I think maybe 10 Australian dollars or 15 Australian dollars, you can buy a book with the information. We're making inroads. The British Thoracic Society have gave asthma the Buteyko method a 1++. So we're starting to get in with the clinical trials. And most importantly, all I will say is if any of your listeners have breathing problems, don't breathe through your mouth. It just doesn't make sense. Your nose is nature's way to humidify, to moisten, to filter. It's got its own enzymes as a natural antibacterial. It sterilizes the incoming air. You've got nitric oxide coming in to help with ventilation perfusion. Anybody with asthma, but ironically, Bill, the vast majority of people with asthma don't breathe through the nose because they feel they're not getting enough air. They breathe through an open mouth. And I have to say this, very few healthcare professionals who are working with children and adults with asthma, very few of them are telling them, listen, start breathing through your nose. They're not just giving them that message. The kid is coming in with asthma, having asthma attacks, and they can be fatal. This is not just about getting a message out there. This is about improving, but more importantly, it's about saving lives. We do not change people's medication. All I do is, for 15 years, if somebody comes into me with asthma, I say, listen, I want to improve your quality of life. I want to improve your asthma control. And then with your physician, your need for medication will gently reduce. So we don't take risks, and we're teaching something with no side effects. You know, so there are brilliant methods out there.
Yeah.
There are brilliant methods out there. Sometimes it's difficult for these brilliant methods to get into the general domain. Unfortunately, a lot of our healthcare is driven by financial and by pharma research, and that is a problem. So it's really about how do we get something that's so brilliant, like the work that you're doing, the work that Clint is doing, simple modalities without side effects to help people. And that's what we should be going, and that's what we would have done for hundreds of thousands of years.
Look, I'm blown away by your method and your ability to really unpack what's actually going on. That's why I got involved. I'm in the middle of building a program. It's going to be 10 steps to brain health for stroke survivors. I don't think there's another program out there that gives people a whole bunch of different tools to improve brain health that they don't have to be doctors to be able to implement or do. And breathing was going to be one of the modules. And of course, my understanding of breathing was nowhere near your level. So having this conversation with you has allowed me to really take that to the next level. Having now the book and all the things that you've referenced for me to go back and read up on is going to really change that module, and it's going to make it enhance people's recovery, because all of what I was trying to do was trying to decrease the inflammation in my brain 4 years ago without taking a steroid that had 60 side effects, and all of them were unpleasant, and I experienced about 25 of them. So as stroke survivors, we go through a lot of these chemicals, and sometimes we think that it's the only way, and I don't believe that the pharmaceutical approach is the only way. And I also don't knock it, because without the steroids in the very early stages of my recovery, I might not have survived. So So I'm very happy to have been given a steroid in that time, but what it did for me required me to recover from that as well for the next year or two, because I put on weight. It changed my blood sugar levels, it changed my blood pressure levels, it did all these things. So I really do appreciate your time, and thank you for the work that you do. And this is my part of trying to help people like you get your message out, because I don't have a budget either, but I have YouTube, and YouTube's for free. And I just love it. Isn't it fantastic?
Yeah.
Where can people find out more about you? Where can they go to buy your book, and where can they read about you online?
We have a lot of resources on buteycoclinic.com. So, for instance, we've put up as much information in terms of showing the science and what's going on, and we've got videos there for asthma, sleep apnea, etc. Wow. I've got about 8 books. There's DVD sets, and it's accessible that people can start using it. They could even go onto YouTube and start looking at what's the basis of it. And when they feel that they're making some progress, if they wanted to go a little bit more in detail, get a book, read a book on it or something like that, So it's totally accessible now. I visit Australia generally every October, November to Sydney. I love going to Australia. I lived there 20 years ago. Did the 1 year as a backpacker, worked in every pear factory in Melbourne or outside of it in Victoria. And I loved it. It was a great experience. So I always love going back to it. In slightly different, of course, but approach. But yeah, so we have people in Australia. There's some great practitioners there, Mim Beam. There's some brilliant breathing specialists in Australia. It's been there for quite a long time. Yeah.
Excellent. I'm going to look them up. And actually, are you going to be doing any public presentations or anything that we could get to see in October?
Sure. Well, come along to our course. We do have a course now. It's for clients. So it's where clients come in and they sit in. Now, the fee is quite reduced. You sit in for 2 hours a day for 4 days, and you get the entire instruction. So it could be a good way that if people feel they really want to kind of do it. And all I'll say is, if people are trying it for themselves, if they are recovering from cardiovascular ill health, don't do the breath holds. Just do the nose breathing. Go for walks, gentle walks with your mouth closed. Like, gently work with your body as opposed to kind of pushing with it, Yeah. And I think people understand anyway that they're not going to take risks. So,
no.
Yeah.
Look, it's been fascinating talking to you on this topic. Thank you so much. And I look forward to meeting you in October or November.
Yes, absolutely. Thanks very much, Bill. It was a pleasure. Thank you.
Well, thanks for listening to this episode of the Recovery After Stroke podcast. If you like this episode or any other episode, please hit the like button if you're watching on social media. Give us a thumbs up if you are watching on YouTube. And give the Recovery After Stroke podcast a 5-star review on your favorite podcast app. Doing that will make the podcast more visible to other stroke survivors that are doing it tough right now, and it could help them feel inspired and feel better about the road ahead. Thanks for tuning in.
Discover how to heal your brain after stroke. Go to recoveryafterstroke.com. Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gassiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation consultation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.